Liposuction is a procedure where we remove unwanted fat. This procedure is mainly meant for sculpting the body. Those who are motivated, those who are ready to do diet and exercise are the right candidate for liposuction. Usually we take the fat from just below the skin, the fat is accumulated. That fat is removed by liposuction. When the fat is accumulated in and around the abdomen or the thigh or over the arm, these are all the common places where we get accumulation of fat. These areas if they go out of shape, we can undergo a liposuction procedure and get it corrected. Liposuction is basically a surgical procedure where we make a small incision, small holes, and within the hole we pass a cannulas and remove the fat. If the overall body is obese and if you have more of fat inside the abdomen, visceral fat, all these things cannot be removed by our liposuction. When our body mass index is very high, then this will not work. So we can reduce only 5 to 10% of our body weight. The weight loss effect can be seen only after 6 weeks to 8 weeks. When you start losing the fat, when you start losing your fluid, everything, your weight loss will be obvious. The fat cells can shrink or grow bigger according to our diet pattern. When we take more carbohydrate food, that carbohydrate will be converted into fat, then it will be deposited in our body fat only. When we do liposuction, we are going to remove only part of the fat cells, not the whole fat cells in the body is removed. So energy stored in the visceral fat and other fats can be always utilized in the future use. Second one is when the shape is lost, only we are going to do a liposuction. When you have a normal curvatures and normal shape, we are not going to do any liposuction on that area. Third one is insulation part. When we do liposuction in particular part, say abdomen, when I remove much of fat in the abdomen, then again when you put weight, sometimes you may not put the weight in the abdomen. The fat cells in the other portions like thigh or arm or the back may disproportionately look bigger because the fat cell in that area may become bigger and cause a problem. Like any other surgery, it is done under anesthesia. Then once you come out of the anesthesia, you may feel some amount of bruising and swelling and little bit of lumpy feeling, some numbness and also a little bit of pain. These are all the regular sequelae of a liposuction. This will be treated with medication and compression garment. Wearing a compression garment is essential to get the shape because the skin will be sagging. The skin has to recoil. It takes 1.5 months to 3 months to recoil. To enhance that effect, we must wear a good compression garment.